This medication is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion and making breathing easier. Dextromethorphan acts on the brain to reduce the urge to cough. If you are self-treating with this medication, be sure to read the package instructions carefully before you start using it. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier or saline nose drop/spray. When taking extra action cough, make sure to follow the instructions provided by your doctor or on the product package. Drink plenty of fluids to help break up mucus and clear congestion. The dosage of this medication will depend on your age, medical condition, and how you respond to the treatment. Do not increase your dose or take it more often than directed. If you are using the liquid form, be sure to measure the dose carefully with a special measuring device. For powder packets, empty the entire contents onto your tongue and swallow, and for capsules, swallow them whole. It's important not to abuse this medication, as it can result in serious harm. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, contact your doctor right away. These symptoms may be signs of a serious medical issue. If you experience dizziness, drowsiness, nausea, or vomiting while taking extra action cough, it's important to notify your doctor or pharmacist. However, many people using this medication do not have serious side effects. A serious allergic reaction to this drug is rare, but if you notice any symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Keep in mind that this is not a complete list of potential side effects, so it's important to contact your doctor or pharmacist if you experience any other effects. As for the best time to take this medication, follow your doctor's instructions. If you have any concerns or questions about the use of extra action cough, don't hesitate to reach out to your healthcare provider. Before taking extra action cough, make sure to inform your doctor or pharmacist if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, a cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness. Drinking alcohol or using marijuana can increase these effects. Avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. It is also advised to limit alcoholic beverages while taking this medication, and to consult your doctor if you are using marijuana. The liquid forms and powder packets of this medication may contain sugar and/or alcohol. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances, it is important to ask your doctor or pharmacist about using this product safely. Additionally, the liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It is important to discuss the risks and benefits with your doctor. It is not known if Guaifenesin or Dextromethorphan passes into breast milk. Consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with extra-action cough may cause a serious, possibly fatal, drug interaction. Avoid taking isocarboxazid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, or tranylcypromine during treatment with this medication. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. Ask your doctor when to start or stop taking this medication. Another product that may interact with extra-action cough is rolapitant. Guaifenesin and Dextromethorphan are available in both prescription and non-prescription products. Be sure to check the labels of all your medications to make sure you are not taking more than one product containing Guaifenesin or Dextromethorphan. Keep in mind that Guaifenesin may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Remember to follow your doctor's advice and instructions for the best results. If someone takes too much extra-action cough and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. Remember to always take the recommended dosage and never exceed it. If you suspect an overdose, seek medical help immediately. If your doctor has prescribed extra-action cough, it is important that you do not share this medication with others. Additionally, it is important to keep all medical and lab appointments while taking this medication. If you forget to take a dose of extra-action cough, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When it comes to storing extra-action cough, it's important to keep it at room temperature away from light and moisture. Be sure not to store it in the bathroom, and do not freeze the liquid forms of this medication. Different brands of this medication may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist. Remember to keep all medications out of reach of children and pets. When it comes to disposing of extra-action cough, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you have any questions about how to dispose of this medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.